Hi, my name is Angela Malik Agarwal. I am the CEO and co-founder of Planet Nourish. Our vision at Planet Nourish is equitable healthcare for all, and we aim to deliver this by linking heritage and health for the first time. There are 6.5 billion people of color on this planet, and that is 82.5% of the world's population. These populations are 6 times more likely to suffer from cardiovascular disease, obesity, and other such diet-related illnesses. And yet, there are currently no healthcare solutions designed for or by them. It's a massive and underserved, underrepresented market worth billions. Our story begins when my mum fell ill in 2018, and in the other video, we've covered in detail our why and our story. What we found is that there's currently nothing designed for and by ethnicity, culture, and religion. And we feel there's a huge gap in the market to create a cutting-edge solution. Our team, again, has come together over the last 18 months to solve a problem that we have all lived with and experienced intergenerationally in our families. Diet-related illness and ethnicity needs to be solved. So what is the opportunity? What is the size of the market? Well, we are starting with the community that we know best, ourselves. The South Asians are a huge demographic. In fact, we are the tip of a very big iceberg. There are 1.9 billion South Asians on the planet. This represents 25% of the global population. And we're a complex mix of ethnicities, races, and religions. And yet we are 6 times more likely to suffer from type 2 diabetes, but nothing is built or tailored for us. Type 2 diabetes is a condition that currently affects 342 million South Asians globally. That's a £2 billion market. In UK and Europe, it is 680,000 people. And if we attain 3% of that market, we are looking at 20,000 people, and 12 million is the size of that opportunity. Interestingly, South Asians over-index in professional services such as banking, finance, law, accountancy, and health. No tailored health and well-being solutions at work exist. And we feel this is a big B2B opportunity for us, along with healthcare and insurance. So our product, well, we've designed a product that focuses on this problem. In a sentence, our product is evidence-based, culturally tailored, and it aims to prevent and manage type 2 diabetes. It is built on our research and focused on 3 pillars: cooking, community, and coaching. Cooking is a big part of South Asian culture. We celebrate food. Live cooking demos are a great way to infiltrate key messages. We also have coaching. We support our nourishers to reach their health goals, and behavior change is the root of our design. Community is key. We have built a community of nourishers. They inspire and motivate each other, as well as tell each other about the program. The Nourish Plate is our main tool. It is the heart of the program. Its messaging is clear and simple to understand. We talk about reducing starchy carbs, increasing protein, and creating half a plate of vegetables. It's a simple philosophy, but we see within South Asians that they are carbitarians. We're vegetarians who don't eat vegetables. So carbohydrate management has been key. Our current program has been lean built and monetized using existing tech such as Zoom, Google Sheets, ActiveCampaign, WhatsApp, Notion, and Slack. We have created a wireframe of our mobile app. It's based on research and detailed customer feedback. It enables access to live cooking, group coaching sections, communication with your community, your cohort, and your coach. People can track nutrients and build menus based on their specific heritage and ethnicity. Our aim is to create vision AI and machine learning algorithms to create highly personalized recommendations. One of the key things we've identified is what we call the Nourisher change maker and multiplier effect. For traction, community is key, and we have found that women are the key change makers in South Asian communities. Each member of our cohort or each nourisher has a huge link between their families and their community, and we are seeing that the movement is growing. Our persona is Rahana Kapoor. We have a deep understanding of her and what's important to her. And we're seeing the benefit of this. 78% of our signups have come from recommendations, and 97% of our signups have reported that they would recommend the PN program to family and friends. Our metrics. We've had great success, and the evidence is really there to see. We have £1,000 per month early stage recurring revenue, over 1,000 users in our community. Our attendance on programs is 91% compared to the NHS attendance of 20%. We are seeing 2% blood reduction in blood sugar over 12 weeks and an average 5% body loss. Our traction has been amazing. We can start to analyze ethnicity in a way that's never been seen before. There are a number of diverse groups within South Asian heritage, and we're not all the same. Our main audience is women, and our cohorts are growing fast. Women make up 81% of our audience, and we have a fast-growing social media and community following. Revenue is currently 1,000, but we're aiming to ramp this up to 5,000 per month in the next 6 months. We have demonstrated excellent product market fit. We want our nourishers to enjoy, engage, interact, and have fun. And we do this through a number of ways, through group Zoom calls, where you are within a group of your 20 nourishers. And we see excellent communication and feedback between the groups. And that's been on WhatsApp. This will all be moved on to our app, where we are aiming to build a one-stop shop for health and well-being of South Asian health. If you think about Mumsnet as a really good example of that. So what has our acquisition strategy been to date? Well, so far, we've had a very successful multi-channel customer acquisition strategy. We've been working with GPs, pharmacies, and they currently contribute 11% of our customer acquisition. Word of mouth is massive. We're seeing 78% coming through word of mouth. And on social media, we are working with some amazing influencers. We have a British Pakistani dietitian who has over 300,000 followers. So the business model. Yes, we have B2B, B2C. However, our main objective is B2B service provision. And this is where we are 100% focused now. The B2C has proven we have market fit and has proven our clinical and non-clinical metrics. What we're really focused on is workplace healthcare, health insurance, and public healthcare providers. We're currently in talks with Aviva Insurance, Aon, PwC, KPMG. For us, the Middle East is also a huge opportunity, and we're in discussions with people like Daman Health. McDonald's is a great example of a workplace scheme where we would be able to pilot and test our program. And this is how we've seen most of our competitors scale through B2B, very much led through the health insurance market. Target would, for example, in the UK be Vitality Health. And we're also looking at companies like Dakadu, who have been growing exponentially quickly in non-Caucasian markets, such as the Middle East, India, and now China. What does our scalability look like? Well, we are operating on 3 diagonals. We're looking at scaling up different conditions, pre-diabetes, gestational, hypertension, cardiovascular, and then across markets, UK, Europe, India, and then eventually into different ethnicities such as LATAM and Hispanic. By 2026, we're aiming at 72 million revenue. The competitive landscape, well, we sit in a unique space, culturally tailored diets designed for and by South Asians. At the moment, most of our main competitors are by and for white Caucasian populations. Our future tech roadmap. We've started to look at iOS, and we will be launching Android app. The next stage is AI solutions. And we're currently fundraising. So we're looking for 250 to 500K, which will provide the next 12-month runway. Thank you.